Well, it was actually on 7th Street. And then the School of Nursing was right beside that, or the old dorms that I think they were built in the 30s. The old hospital was started in 1924. Of course, it had been added on to several times. So what we moved from, there was an A tower, a B tower, and a C tower. But once again, very small. But it was a very exciting time. Everything was new. And even though this part, the A tower, looks very small now, looked very big compared to what we had come from.
It was a big undertaking. I was a student when they were moving, and I was a student in the neonatal intensive care. And so we were bringing the babies in, and just the massive amount of people that required. Just, a few at a time.
And they had to kind of have people at both areas to make sure that they were being taken care of. So it took quite a while for the move to take place.
It seems like they started around 7 o'clock that morning. And of course, I stayed all 24 hours that day. And so it got easier and easier, but that was pretty scary. Everything went smoothly, but you just didn't know what might happen at the time.
During the move, it was a whole different ball game. We went from all of our orders were put into notebooks, and you charted. That's how you wrote on their orders what was going to be delivered. And when we moved here, it went to computers, so it was all new.
I know that even the telephone system was new. I think there were 13 new systems. There was a lot of training going on and just hoping that all that fit together that morning. And it really did. I don't remember any real glitches that went through. Seems like by the end of, maybe even by the afternoon, all of that was complete.
We wore whites back then. Our tops are, and a lot, at first you started in dresses. But working on that floor in a dress is not that simple. So I changed to pants, but you had the white shoes, the white pants, the white shirt, and our nursing caps.
Back then we worked on 8-hour shifts, Monday through Friday, and then on the weekends they did the Baylor plan. There were 34 beds on the floor. We had a few rooms that were double, but most of them were private, and the PDICU was only 4 beds. We also did team leading back then, so you had 15 patients. We would divide the halls. So that kind of made it hard sometimes because you had so many patients to go around and take care of in that time. But you also had nurse aide and nurse tech. And the other big thing that took lots of time was we did hand charting. And we had to chart at least every 2 hours on our patients.
The computer then was just kind of a glorified typewriter, and now it keeps up with everything.
One of my best memories from the neonatal intensive care is our first 25-weeker that we had that survived and did well. And she required hand ventilation because the ventilators weren't good enough to do it. So we would sit there and hand ventilate an 8-hour shift.
Just taking care of the kids with your heart and the patients, that all doesn't change. You still do the same thing, the loving, the caring, and trying to help support them and being a part of their healing process.
I don't think we've lost sight of what our primary goal is, and that's to take good care of the patient.
Northwest has always been a family atmosphere to me. I feel like everybody really does care about each other. I've never had a job where I literally walked in and every single day I'm there, I feel like it's exactly where I'm supposed to be.
I love my job, and I love the people.
It's like being able to come to work with 1,000 of your best friends every day.